healthcare reform. If President Obama actually gets re-voted in, can you stop this retirement Republican Congress? Because it's so important. My wife works across, like you just said, there's 40 people just been laid off. It's going to multiply throughout the country. You're talking millions of people will be laid off because of this law. So how could you stop it if he gets re-elected?
Well, it all depends on the election and the outcomes of the election. If the Senate is the Republicans win the majority in the Senate and keep the House, then at least we'll have another body to work with, and then that legislation, we both agreed on the repeal, it would be put before the president. He would have a steeper hill to climb not to sign it into law. And so this is a robust debate. It really has to do, we thought 2010 was about the health care law. So is this year. And the reason this year health care is a topic is because now we've had 2 years since this law has been enacted. And the very real problems with this law. I talked to the hospitals. I've gone through this already. St. Joe's, Upstate, Cross. Those are our largest employers, and the cuts and the problems that they're going to have because of this Affordable Care Act. Our physicians. I mentioned the woman, after 40 years, her doctor said, "I can't treat you because you're on Medicare." That's here in Upstate New York. That happened this past week. I talked to small businesses. The cost for them to have to cover their employees, and or the fact that they'll pay a penalty and then their employees will lose their choice and be put into this public option. I talked to seniors, these Medicare cuts. They're going to really significantly impact the care they receive here in Upstate New York. You hear Welsh Allen, you hear Cross, you hear there's a company that leases heavy road equipment in here in North Syracuse. They, as of January 1, are going to have to pay a 3.8% tax on their passive income because of the Affordable Care Act. There's 21 new taxes in this Affordable Care Act. It has no tort reform. It's not what we need as a nation to really and seriously have true health care reform. It's just not a serious attempt. It was the Democratic Party. There was not a Republican vote for the Affordable Care Act. It was jammed down the throats of the American people. There's 2,000 plus waivers in this Affordable Care Act. Groups that were handpicked by this administration, by the Democrats, that don't have to comply with this Affordable Care Act. At the very least, when you pass a law, it should be equal protection under the law, and we all should be subject to it. But there are unions, there are supporters of the president, there are a lot of folks, large companies, McDonald's, they've been given waivers, they don't have to comply with this law. This law is seriously flawed. It was a poor attempt. It was a very partisan attempt to really, I believe, get to a single point payer in this country. It's wrong for this country, it's wrong for the economy, it's wrong for the American people, and it is going to seriously damage our access to health care. And we have worked very hard in the Republican House this past year putting together an alternative to this law. This law needs to be repealed, and we keep the good parts of it. We can do that. So keeping your child on your insurance, the pre-existing condition, the Medicare donut hole. We can incorporate those into a new law. Take the good parts of it.
I think Buerkle just explained how complicated the Affordable Care Act and how it's not a big piece of healthcare legislation. I don't support repealing it. I think it needs to be replaced, though, by a Medicare for All healthcare system, like what's been proposed through various bills, like H.R. 676, for example. And I saw someone shaking their head, and I'm sorry. Medicare for All would provide health care to everyone, a Cadillac plan that offers comprehensive care, and it would radically rein in the increasing health care costs that we're seeing in this country. The administrative costs for Medicare are around 3%, while the administrative costs in for-profit insurance are 30%. Now, in our healthcare system, which is extremely inefficient, we're seeing over $500 billion annually going to the monopoly profits of drug companies and to the health insurance billing bureaucracy. That's over $500 billion that should be going to care for the American people. With Medicare for All, I wish I had the study in front of me right now, but something like 95% of us would be paying less for our health care, and the richest 5% pay more. And we can pay for Medicare for all through payroll taxes. And I think of it really as much simpler for employers to provide health care for their employees rather than having to deal with the insurance company bureaucracy like I'm currently doing. I'm getting on a new health insurance. You just pay into Medicare payroll taxes. And Marie often brings up tort reform, and I think it shows that, you know, tort reform isn't. I think that if you're the victim as a citizen, as a patient of medical malpractice, you deserve your day in court. And this is something that even Republican Senator in New York State, DeFrancisco, agreed with, that patients deserve their day in court if they've experienced medical malpractice. And according to the Center for Medicare and Medicaid tort reform, tort and the cost of malpractice and insurance settlements is less than 1% of healthcare costs in this country. So I think it's a very much an exaggerated issue at this point. So I do support Medicare for all for a number of reasons. Personally, because I think it's more humane, and also because it will really rein in healthcare costs, if that's what we're concerned of. Because right now, insurance companies basically make money by denying us care, and that's just not right.